Good morning guys, welcome back to the channel. Today is Tuesday. I'm currently on my EMCC rotation, and what that stands for is emergency medicine and critical care. This is actually my final week on this block, so I just thought to take you guys along, a day in the life. 7:51, placement starts at 8. If you're wondering why I'm still vlogging at 7:50, is because I'm in hospital accommodation at the moment, which is literally like a 2-minute walk from the hospital, so I'm gonna leave in a few seconds actually. But yeah, I just wanted to say hi. Today's going to be a busy day actually, so starting off with placement, which I'm going to go for now, and then afterwards I have a student staff meeting. Well, I'm going to come back for my lunch and then go into this meeting, the student staff liaison meeting. So that's going to be happening at 1, and then I'm pretty sure we have teaching at 1:30, and then another like clinical skills session at 5 p.m. So busy day, packed day, and obviously in between that I'm going to be revising. It's exam season as well ish. Exams are end of May and this is like end of April right now, so going to be quite a busy day. But I'll see you guys when I'm back from placement. Bye. Hey guys, so it's currently 12 o'clock and I'm back from placement. So as I mentioned this morning, I was in ED, which is the emergency department. I had a few things I wanted to get done, like clinical skills, because we have skills that we need to get signed off before the end of the year. And this is my final week of placement in 4th year, which is crazy. So the ones I wanted to get done, I wanted to get at least like 2 or 3 done today. So I managed to get ECG. Another sign off that I wanted to get done was setting up an infusion, an IV infusion. So most patients will have like a cannula in their veins where you can like give medication or fluids depending on what they need. So this patient, which I will tell you about soon, needed IV paracetamol and fluids, and so I set up the infusion, got that signed off, and just a few other like bits and bobs. Anyways, in terms of what I saw today, so the first patient that we saw, actually we spent quite some time on this patient because they weren't too sure what was going on. So this is the 29-year-old lady that had called the ambulance this morning around like 5 a.m. So she was just having like really bad abdominal pain and like vomiting and also like seizing a lot. So she's been having seizures since morning. I witnessed a couple of seizures as well, which were lasting for quite a while, so that was quite worrying. So with her seizures, like unfortunately they haven't been able to find a cause, but she's been diagnosed with non-epileptic seizures, meaning that her seizures are not caused by epilepsy. So obviously like you can't really give any specific medications. If it was epilepsy, then obviously that's like a diagnosis that has treatments and managements for that. But because her seizures are non-epileptic, which you have to confirm with like a brain scan, she's had all of that done and they've concluded that her seizures are not caused by epilepsy. Could be triggered by anything, an infection or like alcohol withdrawal, so many different things that they had to consider, but obviously like they haven't been able to find the cause for the seizures that she's been having. In terms of like the plan for her, she was asking for like pain medicine and anti-sickness because she was feeling really sick and like throwing up a lot. So they'd given her some pain medication and some anti-sickness just to help with the symptoms as they investigate the cause of everything that she's been presenting with. The second patient that we saw was a 74-year-old lady who had come in with, she was having like really dark stools and like diarrhea. So she's gone a few times today already and it's just the morning, and really bad like abdominal pain, kind of all over, but also I think worse, and it's so hard to not use medical terms. I was going to say the left iliac fossa, but that's like the left lower part of the tummy. So the consultant was saying that he was suspecting diverticulitis. I'll put some more information about that on the screen. But also because she's been having like really dark stools, the doctor that I was shadowing was actually suspecting, and I was suspecting as well, something like an upper GI bleed. I'll put information about what that means on the screen as well. They've done a few blood tests and her urea was raised, which could also point towards an upper GI bleed. She's been referred to the surgical team, so they're going to come review her. They're going to do a CT on her chest, abdomen and pelvis just to visualize what's going on inside, see if there's anything that they're missing. Hopefully that can guide treatment. But yeah, pretty interesting morning. Only saw 2 patients because it was busy, but also the patients that we saw were quite complex, and so they just needed a bit more time. Yeah, so it's 12 o'clock as I mentioned. I'm gonna get my lunch now. Quick lunch break in because I have a meeting at 1. I need to get some food in my system before I head for this meeting, so let's do that. I'll see you in a bit. Hey guys! I'm Millie. just had a student rep meeting. I was telling them about this.
So there's one rep per kind of block. I'm in child health, pediatrics, going really well. It's kind of your space as a medical student to like say your grievances with the block and things that you think went really well. No one else wanted to do it in my block,
Same.
so I had to step up.
Oh, you stepped up? No, they had no one stepped up, and they were like, guys, we're gonna randomly select.
Oh.
And they just at me on the main group
Hunger
chat.
Games.
They were like, at Mary, it's you. But it's actually not that serious though. Like,
it's not. It's actually so fine. But my thing is that I was just very nervous. But you know what? This is the thing, guys. This is my advice to all the youth out there, for the young generation. Nothing changes if nothing changes. Who knows what's lying just outside your comfort zone? Think about that. It's too good.
Guys, I'm literally the last one in the library. Pretty sure. I'm done for the night. 10:30 p.m. I leave my bed immediately. Bye. So today is a Wednesday, and as you can see, I'm in normal clothes because Wednesdays are like the chill days of the week, because we usually don't have any like uni activities on Wednesdays. Actually, that is not very true, because this morning we did have a CBD, which is a case-based discussion. So we started off with like medical ethics, where we like discussed a safeguarding case and how we would manage or approach a safeguarding case in a hospital setting. And then we did another case-based discussion on shortness of breath. Anyways, not to bore you guys too much, today's a Wednesday. Like I said, I'm in my normal clothes because I'm heading now to a cafe to study. I have a few things I need to get done. So number one being my engagement logs, which we essentially have to like fill out engagement logs for every day of placement and just like write down what we did, what we learned. So I'm gonna do those for Monday and Tuesday, and possibly today as well. I need to edit some of my videos. So the video that would have come up before this one, I need to edit that because I haven't finished yet. I also need to prepare for some clinical skills, write up a few reflective cases. So we need to like reflect on cases that we've seen in hospital. I'm gonna end the day off with revision again. We always end the day with revision because we love revision. Today I'm gonna be doing respiratory conditions. So I'm gonna head to the cafe now. It's a cute little cafe and the sun is out. I'll see you guys in a bit. Bye. Today's Thursday and it's currently the afternoon. Usually Thursdays are days of placement, but today we have loads of like teaching and OSCE sessions. If you're not familiar with what OSCEs are, those are just essentially like our clinical exams where we have different scenarios and we get to role play as doctors, and we get examined based on whether it be a history taking scenario or like for this block specifically, because it's emergency medicine, a lot of the stations that we have are like doing an A to E exam, which I might put some more information about that. Just an examination that you'd want to do when a patient presents to the emergency department. The ones that we have today are not exams, they're just like practice sessions. So we started off the day with that at 10:30 and that finished around like 12:30. Next up we have teaching at 2 p.m. So before that I'm just gonna have a quick lunch. After that I have a session from 5 to 7 p.m. which is another OSCE session, but this was like a sign-up session, so like if you're interested. I obviously want to work my OSCE skills, so I did sign up for that, and that's going to be like a full 8 stations, so like the actual OSCEs. So I think it'll be really good practice. I'll probably just like have my dinner, like shower between 7 to 8, and then like do my night shift revision from 8 p.m. onwards. I'm gonna have my lunch now, so I will see you guys later and keep you updated. So yeah. Hey guys, today's Friday, so I just had my last morning in ED, which is the emergency department, and I was actually in pediatric ED, which is for children. I saw a few patients this morning, just like followed the doctor around, managed to get like my last few sign-offs left, so that's just completely done, honestly. So grateful for that. And then yeah, had my lunch and then came back to the flat and did not expect, honestly, to get emotional, but it's not just the end of my ED rotation, it's also the end of 4th year. Like, this is my last. Guys, my voice just cracked because I'm getting emotional again. This is my last rotation in 4th year. Honestly, just like really emotional, just like really grateful to God, honestly, because I'm just so grateful to be here. So yeah, this brings us to the end of this vlog. I really hope you guys have enjoyed, and stay tuned for other vlogs. I'm going to try and vlog a bit of exam season so you guys can see what it's like. And yeah, maybe just vlog here and there, probably not every day, but as much as I can. And then from then on it's going to be final year vlogs, which is just like insane. But yeah guys, thank you so much for watching and being here. If you haven't, make sure to subscribe, make sure to like this video, comment down below, turn on post notifications so you know when I post. And yeah, I'll be with you in my next video. In the meantime, if you want to follow me on my socials, I do have Instagram, so it's mary.olayomi. But yeah, I hope you guys have a blessed week, rest of the day and all that, and I will see you in my next one. Bye.